There we go. We are recording. Good afternoon, everybody. My name is Perry Chen. I'm one of the personal counselors with Skyline College Personal Counseling, and welcome to our wellness webinar. We have a series of webinars planned out between now and the end of the semester around wellness and how to sort of care for yourself and care for others around you. Today we have our guest, well, it's one of ours, Dr. Walter Cheng, who is the physician for Skyline College and also a practicing physician with Stanford. And he is going to be talking, this is his part 3 of what to do about the coronavirus. And we will have an opportunity, if you have questions throughout, you can certainly enter them into the chat box. And then Walter will give a talk, and then he will, of course, be able to answer questions. So with that, thank you, Walter, for joining us.
Oh, no. Oh, thanks, Perry. Well, it's good to see some familiar faces, and you know, I'm sure people try to trickle in. This is our third talk, and I think we've been doing talks about every 3 weeks, give or take or so. And so what I wanted to talk about today for the next 15 to 20 minutes is just to kind of give a bit of an update on what is going on with the coronavirus outbreak, you know, locally, nationally, and globally. And I want to talk a little bit about sort of where things will go from here and some of the changes that have occurred since the last time we talked about 3 weeks ago. So, you know, I think that locally, oh, and the last thing I really want to talk about was some good sources for information for people here so that, you know, we're not getting exposed to fake information or misleading information. So I think that to start, you know, how are we doing locally? I think that people have probably heard in the news that the Bay Area has done a pretty good job of quote unquote flattening the curve. And so what we've seen here, and I can tell you because I do a lot of frontline work in the hospitals right now. And obviously for a number of weeks, we were very worried that there was going to be a surge of cases that would overwhelm the healthcare system here in the Bay Area. And fortunately, that has not come to fruition because I think we were so early in the shelter-in-place orders here and the physical distancing orders that went into place earlier than any other locality. And as a result, you know, the good news right now is that if you need to be hospitalized for COVID-19 or for any other reason, you know, the bed capacities for most hospitals in the Bay Area are good, actually. We're actually in pretty good shape. And the one thing that's really been good about this too is it's given our hospitals time to develop good protocols so that we can protect our healthcare workers pretty well here. We've been able to, most places have been able to secure a decent amount of PPE in the area. Obviously, some hospitals are a little different than others, but I do think that if there's one good take-home message right now, is that all the efforts that all of you have been doing with sheltering in place and lowering the transmission is that it's given healthcare workers and healthcare institutions the time necessary to develop the plans, get the equipment we need to take care of people who might be getting sick from COVID-19. And this is in contrast to other places in the country and around the world that maybe were a little bit slower on the uptake, and as a result, did get a lot of excess cases where they overloaded their systems. And I want to talk just for a second about how important it is to not overload a healthcare system. And it's not just the COVID-19 issue. There's a lot of downstream effects. And so, you know, if a hospital is completely overloaded with COVID-19 patients, not only do those patients suffer and not get the best care, but everyone else who needs to go to the hospital for other reasons, like other infections or heart attacks or strokes, can't get the care that they need. And so they have a higher chance of having bad outcomes or dying from those things. And so when we talk about COVID-19 deaths in this country, realize that when a system is taxed, not only do the COVID-19 deaths go up, but deaths from other causes go up too. So really, you know, we've really done a pretty good job here, you know, preventing those things from happening. You know, I think that you know, nationally, it does also seem that the number of cases seems to have peaked for the time being. So the total number of national cases per day, of new cases per day, seems to have hit a peak and is coming down. There's a lot of variability, so there's still outbreaks going on in different parts of the country, but the overall sense is that we've hit a peak and we're coming down. The challenge is that our cases rose very fast, and now they're coming down, but they're coming down slowly. And we don't know exactly how accurate that really is because we still don't have great testing. And so we're not really able to tell the curves going on. But I think if you look at the curve of cases, you look at the curve of new deaths per day, which is pretty accurate, it does seem like things are getting better. Okay. And I think this is now causing a little bit of anxiety in the population. And it's totally understandable where a lot of people are suffering from the shelter-in-place orders, that they have lost their jobs or their jobs are in jeopardy, rent is due or mortgages are due, and there's a lot of a ton of anxiety about this, and people are really suffering. And I think a lot of people are very anxious to lift those orders, and the question is when, that I've been getting a lot is, when is it going to be safe to lift these orders? And I wanted to talk a little bit about sort of the parameters that we use in healthcare and in public health to try to decide when that is. And the thing about this is that we have to look at other countries' experiences and what they've been doing. One of the major holes right now, which I've alluded to, is the fact that in the United States right now, one of the reasons we can't lift the shelter in place is we don't know who's contagious, because we're not testing everyone. We're only testing high-risk people or people with obvious symptoms. And so as a result, we know with this coronavirus that a lot of people, up to 25% of people, have absolutely no symptoms. And then probably another percentage of those people have very mild symptoms who could be transmitting it from person to person. And if we don't know who those people are, then if we were to open up shelter in place such that people could actively mingle with each other, then you would actually see another spike in transmission. And even though, the cases seem to be going down, we know that 90+% of us still are not immune to this virus and could get it, and we could be the unlucky ones getting sick. So I think that shelter in place or some type of physical distancing is going to need to be in place until either one, we have a vaccine that will protect us, two, that we can develop an inexpensive treatment to treat people who get sick, or three, we can develop better tracing and testing so that anyone we identify who's sick gets automatically quarantined for 2 weeks and can't expose other people. If we can't do one of those three things, then some amount of physical distancing is the only strategy we can be left with. Okay. And so thinking about the vaccine timeline, we've talked about 12 to 18 months. I will let you know that I think that's very optimistic, because not only do you have to develop the vaccine, but you also have to develop the manufacturing capabilities, the distribution capabilities of getting that vaccine out to 6 billion human beings and certainly 300 million Americans. And that's not easy. So I think that instead of 12 to 18 months, you've heard about people, sure, we might be able to find a vaccine, but it could take 2 to 3 years. In terms of treatments, certainly that's there's a lot of research going on right now. So I don't know what the timeline is. I think the key thing is some of these treatments are really inexpensive and some of them are extremely expensive. And so we've talked about hydroxychloroquine in the news a lot. That's super cheap, but doesn't look like some of the data are that promising. There's this IV drug that Gilead's making called remdesivir. You may have heard of that through the news. I'll let you know that's probably gonna be like $2,000 a treatment. So not a treatment that's going to be widely available for 50 million Americans take, and then other things in the pipeline. But so I think the cheapest and fastest thing we can ramp up is testing, I think California is starting to do that pretty well. Other states are behind. I wish the federal government was better at coordinating all this, but we're still probably weeks and weeks and weeks away. So what does that mean for us? I think that the current shelter-in-place orders for the Bay Area currently run until May 3rd. It is my feeling, just so everyone is aware, that the sheltering in place will likely continue for at least a few more months after that. Now, it may be different than the current form that we're in right now. And so if we continue to see a decrease in rates, I could see the possibility of opening up, more businesses, especially manufacturing businesses. If you're in a factory, configuring the factory so that people are more spaced apart, opening up non-essential businesses, but maybe for things like a curbside pickup kind of thing. So those can start to operate. But I think unless those three factors are met, we really need to keep staying apart. Okay. Another thing I think is going to be a bit of for us to know is actually this issue of masking and whether or not it's going to have an effect. If you guys attended my talks in the past, I was a bit of a naysayer about masks. And the reason is that the only mask that's been proven to prevent the spread and prevent the transmission of viruses is the N95 mask, which we certainly just don't have enough of, even in the healthcare setting, and it's not going to be available commercially right now. Also, if anyone's ever worn an N95 mask, if you've ever worn one, you cannot keep it on for that long. It is like, it takes like 3 times the effort to breathe, and you can't wear it all day, and so it's just too uncomfortable. So then you have this like hodgepodge of masks out there, including surgical masks that some people have, simple construction masks, face cloths, bandanas. You've probably seen a ton when you go to the supermarket. And I think what we'll need to know is what the data show. I actually had a chance to look through some of the data today. And I think, again, the key thing is that masks actually don't do a great job of protecting you from getting the virus. So if there's a room that you're in that has circulating virus, wearing a mask actually does very little directly to protect you. There is some data out there that shows that if you wear a mask, though, there's 2 things that are beneficial. One is it probably lowers your chance, if you're one of those asymptomatic carriers, one of those people who have the virus and don't have symptoms, that you're less likely to transmit it to other people. Because when you cough or you sneeze, that cloth captures a lot of the droplets and doesn't let it sort of float out into the air and settle on surfaces. The second thing, and this requires some discipline, is that the mask oftentimes for us is a way to train ourselves not to touch our face. And so I've seen a lot of people picking under their masks, I'm like, well, you're defeating the whole purpose. So when the mask goes on, it should be a cue to you that this is a no facial touch zone. And so you're going to be getting coronavirus generally not from breathing air around you, unless someone just coughed, but really from touching contaminated surfaces and then touching your face. That's how that's how this is usually transmitted. So, now that I've looked at the data, I think that there is absolutely no harm to using a mask or to use some type of facial covering. And it probably has some benefit in reducing the spread between people, even if it doesn't protect you directly. And as you may know, I think as of April 17th, all Bay Area counties are requiring people to wear facial coverings in public. And just so you guys know, there's a lot of studies looking at what type of fabric is best. So as that data comes out, I'll be able to kind of update everyone on that. So, that's kind of like the update of like the virus right now and sort of how things are going with it. Actually, Perry, I realized I don't think I opened the chat here, so I just want to make sure. There it goes, just in case anyone's typing anything. The other thing I want to do is talk about reliable sources of data. And I think that the most reliable source of data right now are coming actually from the county public health websites. I think the thing about it is, I think how many people here on social media with Twitter, Facebook, Instagram, all that. Yeah, everyone is, right? And I'm sure tons of your friends are posting news articles or stuff they've come across, and they're like sharing the link and stuff like that. I have to tell you, you have to be very, very, very careful, because there's a lot of misinformation spread out there, or a lot of incomplete information spread out there. So, I'll tell you a good example. So my dog gets heartworm medicines every month, and I tried to order a replacement for it, and I realized they're completely sold out. And I was like, why is this? And it turns out that there is the drug that's used, a drug called Ivermectin, which treats dog heartworm, and but also treats some human things like scabies and some tapeworms and things like that. We don't use it very much in this country. And I can't find it now because there was some study out there where someone's found that if you put ivermectin onto a petri dish that with cells that are infected with coronavirus, that it would kill the coronavirus. I'm like, that's great, but I think people are extrapolating now that that medicine somehow can kill it in your own body. And that's not where the research is right now. So it's not fake information that ivermectin or this drug can kill coronavirus in a petri dish, but we don't know if this is actually going to work as a drug in your living body. And so, but now this has caused a humongous run on this drug. I can't get heartworm medicines for my dog. It's kind of sucks. But I think the key thing here is to be really careful about the data, because there's a lot of data that isn't truly false, but it's incomplete. And I think people are running on those hunches, and that's very dangerous. I don't know if people have come across there was some excitement about hydroxychloroquine and chloroquine as a drug. And then unfortunately was a death of a man because I didn't realize this, that chloroquine is actually used in fish tanks to clean fish tanks, but it's a slightly different chloroquine formulation than what humans take, and it's a much higher dose. And so the guy couldn't get a prescription for human chloroquine, or didn't ask his doctor, but say, hey, my fish bowl cleaner or my fish tank cleaner also says it's chloroquine. And so why don't I just take this to prevent myself from getting coronavirus? And he died from complications of the overdose. So what I'm telling you right now is do not trust I see it. Yeah, I believe him and his wife both took it. That's right. His wife was actually in critical care in the ICU, so she also got sick too. So this is where false or misleading or incomplete information can really lead to bad choices. And so I want everyone to try to really focus on getting good data sources. So actually, I'm gonna open up. I hope I didn't lose my connection here, but sorry, I had to look up the website again. So it's the San Mateo site actually is quite good. It's SMC, so that's San Mateo County, smchealth.org. I'll actually can type it on here. So it's smchealth.org. And there's a coronavirus or COVID-19 link. And it's very, very helpful because it has links to all the data in the county right now. And if actually you're curious about how we're doing in terms of healthcare utilization, how full are the hospitals, are we using all our ventilators, all that stuff, it's tracking all of it for you and the number of cases. All the public orders that are coming from that from the county are available for you guys to use and to kind of follow along. If you want really detailed numbers about how things are going county to county throughout the country and also globally, the Johns Hopkins coronavirus website is really good. And I'll type that. Oops. It's coronavirus.jhu.edu, and they have really, really good maps to kind of show where things are going, how things are spreading. And I think those are two very useful sites. I would say, actually, to be honest right now, some of the news sites are really kind of a bit disappointing. And so, you go on to national news sites like CNN or things like that. And what happens is that I think they want to hook onto a sensational news story. And so they're like, wait, maybe this drug will work, or maybe this is, but it's all incomplete again. So I think that we really need to follow real data right here and not follow hunches. This is what the medical community needs to do and healthcare researchers need to do. We need a little time to really know what's going to work best. So the best thing everyone else can do right now, the proven thing we can do right now is physically distance. I think wearing masks has some data emerging, and we know there's no harm to wearing a mask. So do that. But at the moment, just to reiterate, there are no treatments that are proven effective. There's no prevention. There's a lot of stuff out there about certain supplements that might prevent. We don't have any data on that right now, and so we still need to get that data. So don't jump on anything until we get some more information. So I think that's what I wanted to say. Is there? I'll throw it to Perry real quickly. Is there any particular topic areas you think we should talk about before maybe we open up the questions?
Well, I do see a topic area, and there's questions I had, but I think, I think that this is great information, especially with the San Mateo Health County information website. Just it's really good to know where accurate information is coming from, because, like you said, there's so many different things flying around. There's a question from Cassie, and you can certainly read that. And
Yeah.
the question in the vein that I kind of want to take this conversation, and this is, we don't want to take this conversation political necessarily, and we also know that you cannot predict the future.
Right.
But there are, everybody's. I think at this point we've been in shelter in place now for about 5 weeks now, something like this, and people are wondering, what is it going to look like? Is the end in sight? And with that, sort of two pieces. One is that there have been protests, as we've seen in the news, and we see pictures of people not wearing masks, not necessarily socially distant. Will this have an impact, probably in those local areas, but can it have an impact for us over here? I can't remember what my other question was, but it was related to this. But yeah.
Okay. This is really challenging. It's really a challenge, and I think that from a policy standpoint, and I will try to be as non-political in my statement as possible, but there's no doubt that shelter-in-place orders make a huge difference in terms of lowering the number of people that get sick quickly. But there are huge consequences to the shelter-in-place orders too. And so many of us are feeling this pain of being sheltering in place, both economically, psychologically, all sorts of different factors. And so, how can I put it? I think that we as a society need to actually reckon with, what is acceptable in terms of outcomes, right? And I say this because I don't think there's any way to prevent all deaths from coronavirus. We have to accept the fact that more people are going to die from this, no matter what we do, So I think we need to have a talk, because I think, let's take the flu, for example. I'm just going to use this as an example. We do everything we can to try to mitigate or to lower the risk of flu deaths in this country. So we hammer the message, get your flu shots every year. We know that flu shots aren't 100% effective, and we have some medicines for flu. It's not 100% effective. Could we prevent the flu by sheltering in place every single winter time during the flu? Yeah, we could do that, but we've made a choice as a society not to do that. Now, I think coronavirus is a different issue right now because it's a virus we're much more susceptible to. It's probably deadlier than flu, so you have to take more drastic actions. I think at some point we have to open up businesses and do that slowly and see what happens. But it has to be done in a rational way where we can try to protect our society as much as possible. Now, I think that Cassidy had mentioned that some states are opening this weekend. I will caution, I don't think that looking at the curves that we are ready to open up right now. Now, Georgia, I think, is the main state that's opening up, and they're not just opening, right? So some of the things at Georgia, I have to tell you, at some level, this is a totally personal comment here. It'll be very interesting to see what happens in Georgia, because it's actually a bit of a test run to see for other states, what is the effect of this? And unfortunately, when you open up, you won't see the effect of it for at least 2 or 3 weeks because it takes that long to start transmitting and people to get sick. But certainly the idea of opening non-essential businesses to like a curbside delivery, which I think Georgia was doing, is not a bad idea. Actually, I can see California doing that. The things I don't support that Georgia's doing is I think they're opening up churches and movie theaters. I'm not sure what the rules are in terms of how far people have to be spaced apart, but I think any situation where people are sitting down in an enclosed space for a prolonged period of time is dangerous. And so, I don't like that idea of it all, but we'll see. I think if being the cautious person here in California, I'm grateful that our governor has not made any push to loosen restrictions right now, because I think we have clearly seen in the Bay Area here, and particularly in the state in general, that we have really kept cases down, and I'd like to keep it down. I think I got off a little tangent there. Does this? And then when do you, I'm just going to finish reading Cassidy's statement. When you say you think some form of shelter in place will be happening for a few months, do you mean California specifically? I think so. I mean, I think that, the states that are listening to the public health officials will probably do some type of shelter in place for at least a few months. And I'll tell you, as I mentioned before, I don't think we'll actually have an effective vaccine or effective treatment in a few months. So I think our lives will be different, for a long time. I think there'll be some return to normalcy, but I think a really good example is looking at Asia. I'm from Taiwan originally, and SARS. Well, I wasn't there for SARS, but when SARS came out in 2003, it didn't infect a ton of people, but it had a very high mortality rate. So about 10% of people who got it died. It was huge. And so it changed Asia. So if any of you actually have been to Asia in the last 15 years, you'll notice that like 30% of people wear masks all the time anyway. And they have a culture now where if you feel a cough coming on, you feel a little sick, you put on a mask. It's changed the way that people behave there. I think at some level, this virus will force us to change some of our behaviors. I think that going forward from here, even if we start to open things up, we'll probably recommend that people wear masks, when they're in public or in enclosed settings, for at least the next few years, maybe. I think we'll change the way that we shake people's hands. That that elbow bumps will probably be like the norm, or developing some other greeting will probably be the norm. So we're not spreading diseases. So I think that this tight shelter in place will probably be lifted gradually over, relatively soon, but true return to completely where we were in February is not something that we can expect for even a few years. And the president talked about a 3-stage plan. I'll tell you again, try not to be political, but the 3-stage plan was like 3 PowerPoint bullet points, and opening up is far more complicated than that. So, yeah.
Walter, thank you for those questions, and everybody else who's present, please feel free to ask other questions within the group chat. So I have a couple questions, I guess, from a non-doctor to a doctor, which might be, you can perhaps educate us. At this point, you mentioned, the hospitals have capacity, at least where we are in the Bay Area, which is, great news, and we didn't get that surge like we predicted. Actually, I guess there's a few questions. Everybody talked about the surge and fall when you spoke about this last time. So that's one piece. The other piece is, as consumers, when should we be thinking about going to a hospital, if at all, or is it still the same advice as it has been before?
Yeah. So I think the thing right now, if you think you might have COVID-19 symptoms, I would reach out first to your primary care doctor if you have one. And if you don't, you can also reach out to the county, to the San Mateo County Health Department as well. They can also give you guidance. So some private providers are able to test you if you're sick but not sick enough to go to the hospital, and some can't. And then if they can't, there's systems in place now to determine whether or not you should be tested or not. With the knowledge that over the next couple of weeks, we should be ramping up our testing capabilities to essentially test anyone who wants it. That's our hope, because that we need that to start to lift the shelter in place. So they're working on that. So if you feel like you are getting some symptoms, contact your primary care doctor or contact the smchealth.org website. There's a contact number for COVID-19, and call them. And as I said, the reason I'm being a little bit vague right now is the advice right now is typically people only who are pretty sick or in a high risk group. Let's say they're older, let's say they're in a nursing home, things like that, they would get tested. If you're younger, you probably wouldn't right now, but that could change next week. So we're not doing this every single day, this talk. So if you were to get feel symptoms, go and talk to your primary care doctor or to the county health department. I think the symptoms to actually go to the emergency room to seek out medical care are, if you have fevers, over 100.3 Fahrenheit, which is about 38 degrees Celsius, and that persists for more than 24 to 48 hours. Many people with COVID-19 will have a mild fever and a cough. If it feels to you that you're not feeling particularly short of breath, that you're comfortable breathing with a mild fever, a mild cough, I think it's okay to stay at home. And at that point, to absolutely not go out. You do not want to get in contact with anyone. If you're in a house, if there's any way that you can segregate, I know not everyone's house allows this, to your best of your ability to limit as much interaction with anyone as possible if those symptoms arise. And then contact to see if you can get tested or not. If you develop symptoms where you really are feeling short of breath, that you cannot catch your breath, that is the sign that this might be a more serious infection. So that, if you feel like I walk across the room and I have to catch my breath, or I can't get up a flight of stairs because I'm out of breath, other symptoms including like I'm coughing so badly that I can't sleep, or my fevers have been going on now for a couple of days and they will not go away. That's, I think, when it's important to actually go to an emergency room. When you go to any emergency room now, generally in the Bay Area, with those types of symptoms, you will be tested. And obviously they can do other further diagnostic testing to determine whether or not you need to be admitted to the hospital.
So actually, I have a follow-up question. That's a great answer. Thank you. Just to clarify, because I think people are very scared to go to hospitals or go to their doctor. And just a plug out there, for those of us who have a primary care physician, you should be able to contact your doctor's office, and there might be telehealth options as well. And Skyline College Health Center, we actually have our telehealth set up now, so our nurses can do telehealth sessions. So for those people who are interested, and I'll share that information in the chat room in a minute. I do have a follow-up question about this. So I've been having a cough, no fever or anything like this, but I definitely have friends or family who have had a lot of the same things you've talked about, and thankfully they're fine, but they never got tested. Is there any sort of way to, first, again, a two-part question, is there any way to sort of, I hear about these antibody tests, if that exists, to see if I've been exposed, and would that be at all helpful to know? Like, let's say I had coronavirus, is it helpful to know I had it like 2 weeks ago, or is it just like not important information?
That's a fantastic question. It is a bit of a mystery. And so the antibody tests, I think we are still working on. So I'll step back. One of the challenges about all the tests right now is that we don't actually have a centralized test developer. And so when you get tested for COVID-19, the actual virus, each lab is kind of developing its own thing. So like a company called Abbott did their own test, and Quest did their own test, and Stanford and UCSF had developed their own tests. And typically these tests go through an extended review by the FDA for approval. But because of this crisis, we just fast-tracked all the approval. So to be honest, the test for the virus in itself, and I'll get to the antibody in a second, the accuracy of the tests are slightly variable from place to place. And we've hodgepodge together. Now, when it comes to the antibody, it's the same thing where those are even newer tests. So at least now with the COVID-19 tests, we know that the county tests are pretty accurate. We know that the Stanford and UCSF tests are really pretty accurate at this point. We've been able to validate them. The antibody tests all just came out within the last week or two. So we are still, here are the unknown questions. When you get a positive antibody test, how many of them are false positives? And if it's negative, how many are false negatives? We still don't exactly know. It's probably pretty good, but we don't know. And what is the utility of that antibody test is what you're getting at. And I think the thing here is that I think that the antibody test in its current state is important only for research purposes. And the research question that the antibody test answers is how many people actually have been exposed to this virus? Right? And which gives us a sense of how badly has this actually spread, because we don't know the answer to that. But for the person who's getting the test, the question we don't know the answer to right now is, are those antibodies actually predictive of two things? Of the main thing is, does it mean that once you have the antibody, that the virus is completely gone and you cannot transmit at that point? And the other question is the antibody protective, meaning you can't get this infection again? We don't know the answer to those things. So so we'll know more. Again, typically when new diseases come out, it takes us a year or two to really answer those questions. Obviously, scientific labs are working overtime right now to try to get those answers faster. But everyone has to understand that the research in the United States really just ramped up 6 or 7 weeks ago. And so I can't give you those answers right now. And I don't want people, if they get the antibody test and a doctor tells them, oh, you have the antibody, for them to start partying it up in a bar or a club, and like shaking everyone's hand, because I can't tell you that those antibodies are protective for a reinfection. And obviously, we don't know how COVID-19 might be mutating, just like the flu mutates. So I just can't answer those questions about the antibody test. It's really, I wish I could give you better information. But it's great that you're plugging the telehealth sessions. We do have our nurse practitioners and nurses up to speed on that. And so certainly if people need advice, our health clinic is a good resource as well.
It looks like we have a question above the health resources about animals.
Oh,
that one out. Mm-hmm.
Yeah. This is also, I wish I could give you a firm answer. It is interesting. I think that, yes, there was a zoo worker at the SF Zoo, and I think it was 6 tigers and a lion. Maybe throwing a bear to say, oh my, to it all. Anyway, yeah, so there was, as I said, I've been reading a ton of data out there, and I know that I don't know the exact information, but it turns out some of these big cats actually develop respiratory symptoms, which was interesting. And there was also a case in Hong Kong of a woman who tested positive, and they had to just take her dog to the shelter while she was in the hospital, and they decided to test the dog, and I'm not sure who did that, but the dog tested positive, but the dog was asymptomatic. So you don't know if the dog like licked something and it just had the virus in its mouth, but it wasn't actually infectious or contagious from the dog. It's really unclear. So here's the thing, the thing about viruses is that viruses transmit between animals quite frequently. And the question is that when you transmit, can the newly infected animal then transmit again? So what can happen sometimes is you get what are called dead-end hosts. And so, for instance, we know that, well, I'll take the flu, for example, right? I actually don't know if dead-end hosts for flu. But the reason why flu circulates and mutates all the time is that flu exists in many different species. So you've heard of avian flu, like other bird flus, also horse flus, swine flus. It's because human flus we can sneeze on a pig if we have the flu, and the pig will get sick, And then the same pig, if this pig has a flu, they can sneeze on us and give us their flu, right? It's just weird. And so a duck can do the same thing to us, or a chicken can do the same thing to us, or a horse can do the same thing to us. Now, with COVID-19, it seems like a human can give it to a cat species. And presumably, if a tiger could get it, your household cat could probably get it. And the fact, and this is again me guessing, the fact that if 6 tigers in the same pen got it, it's probably pretty easy to give it to them. The question I have that isn't answered is, can the cats give it to each other, and can the cats give it back to humans? And that's not known. And so I don't think we know that now. I think there are some guidance. I'm sorry, I didn't look this up, but there is some guidance right now that tells you essentially, if you have an indoor cat, just don't let it outside, and if you have a dog, probably, I don't think dog park runs are even open right now. So they should probably, you could definitely walk your dog, but you don't want to be socializing at this point with other animals, just to be safe until we know more info. I'm sorry. I wish I could. That was kind of a weird answer.
Well, I appreciate the information, and I think all of the people who are attending appreciate the information you're giving, because even though nothing is conclusive at this point, there's so much that's inconclusive. But to even at least hear the information that's out there and the directions that researchers are taking is helpful information. And to it's good to know what we don't know, and that's really important. So, even though you don't have conclusive answers necessarily, I think it's valuable information that you're giving. So
yeah.
Thank
So
you for this.
one thing I'll throw it out there is that I know that different county health departments are going in the next few weeks to ramp up community testing of antibodies for their own research purposes. I haven't heard it from San Mateo County yet. I heard from Santa Clara County that they're starting to do that. If people get notices about that, I would, if you want to help the medical community right now, I'd actually sign up to get to give a sample of blood. Especially if you think you've had some type of minor symptom, like you were saying, Perry, like you've had this little bit of cough. Some people in your family might have a cough. Giving a sample of blood is safe to give, and if there's a call out for volunteers, I would encourage people to do that, because the sooner we can get some more answers, the more we can give you better information. So,
other questions that others have, please feel free to enter in the chat box. I see another comment there. If you come over, Walter.
When did see my grandma? Oh, this is really tough. So regardless of what happens on May 3rd, and depending on how things look, when do you think it would be safe to see my grandmother again, or someone in a higher risk category? This obviously tugs at everyone's heartstrings, because we just can't see our loved ones, and that's really, really hard. I wish I could tell you an answer to that. I think right now, again, cases are starting to come down, but the case loads are still pretty high. And, I just don't think it's safe yet. I will keep the question in mind when we hopefully can do this again in a few weeks and give you another update, the reason this is not meant to scare people right now too much, but I'll let you know that in hospitals right now, no hospitals are allowing any visitors. And one of the most heartbreaking things I've had to deal with as a physician is how to handle dying patients in the hospital. I've actually been very lucky that none of my patients with COVID-19 that I've taken care of have died. And actually all of them have recovered, the ones I've personally taken care of. But in the hospital, obviously we get people who are dying of other reasons, of cancers, they've had a big heart attack or something like that. And up until 2 weeks ago at Stanford, for instance, they allowed no visitors. So everyone was dying without family members next to them. And now they're allowing one visit by 2 people for like 30 minutes, just one time to say their goodbyes, and that's it. And so I had a patient, an elderly man who was dying, and he had a wife and 4 children, and they decided that it was going to be the wife and one of the children who could come, and they had to decide which one of the 4 was going to see dad. And that's a heartbreaking situation, and not to make this scary, but right now we need to protect the people who are vulnerable. And so, because I don't want anyone to be put in that situation where they are sick and alone and scared in a hospital and their families can't support them, and it's just so stressful for everyone. So I know it's so stressful not to visit your grandmother right now, but to think that if not you, but anyone were to expose your grandmother to something, that she would be alone in a hospital right now without anyone. But, obviously the nurses are, and we are trying to do our best to provide support, but we're not the family members. So please help to keep them safe by staying distant for now and finding other ways to interact with them besides physical, closeness.
Thanks. Let's wait another minute for other questions. And as people are thinking of other questions, this is sort of a gotcha, but I'm hoping based on what you just said earlier, is there any stories that you can share that have been like sort of positive things or things you've seen, whether it's in the hospital or in your professional life, that kind of, just a nice way to wrap things up, stories of, the good in humanity and this sort of thing.
Oh yeah, I think that the thing that's so wonderful is, again, I think that we wouldn't be seeing the success of the shelter in place if people weren't coming together and really working hard. I mean, I think the compliance to these orders has been really fantastic. Yeah, you hear the news about these nut job, I'm going to call them a nut job, protesting, but we know that 99% of us aren't like that, and that's really great. What I've seen, which is amazing, is just the efforts that people, especially as a physician, it's almost brought me to tears, just, like having friends saying, I've got a sewing machine and all this excess fabric, like, I can make you 50 masks the next week, and I'm going to rally my friends to do it. we had another, there was a group of Chinese families in Palo Alto that did this huge like online fundraiser and got like 50,000 masks for an urgent care clinic in San Jose. Just incredible, outpouring. And within the medical community, within the hospital too, I think, nurses and doctors and even the support staff, we have, a lot of people are under a lot of stress, but there's a lot of free donuts being shipped over to us, and so we really appreciate all of it. So I'm gaining a little bit too much weight. It's not good. The combination, like the gym is closed and I'm getting free donuts, not good, not a good combo.
You're getting the Corin 20.
Yes, exactly. Let's see. My cousin's a nurse working COVID Florida hospital. What are you doing as a medical professional coming into contact with positive patients coming home to your husband and dog? My cousin's staying completely away and staying with a coworker who's also working with their suggestions. Also for fabric or washable masks, any suggestions on the best way to wash these masks? So, I think if the situation was like New York, I probably wouldn't be coming home. But the caseloads are actually a little bit lower, that I feel okay. So I have this like routine. It's ridiculous, the routine. So basically, I pull into my garage. I have hand gel in my car. So I gel my hands so they're clean. I open the door and I immediately go into the bathroom and take off my clothes, and there's a little hamper that we set up in there with just my work clothes. So it goes in the hamper, and then I take a shower, and then I change, and then I'm okay. So I think we developed that system where I decontaminate myself as best as possible, and then I'm only wearing the same. I designated an old pair of sneakers that's my hospital footwear, so I don't actually wear that into the house. I don't bring it in. I leave it outside. So that I'm trying to track as little as possible if it's on my body. And we know that generally speaking, if it's, let's say, I don't know, if someone coughed on my scrubs, at some point, I'm not like blowing out my scrubs in the room. So I'm just going straight to the bathroom and taking it off. That's what I've been doing. I actually think if I can say, like, your cousin staying with a coworker, the danger with the coworker is that now you're having two healthcare workers with a lot of contacts. And so I actually think it's kind of risky personally, but, and then fabric, best way to wash these masks, hot water. So you throw, if you use reusable masks, fabric masks, what I would do is only use it for one time, and then you should wash them. So, people probably, if you have a fabric mask, you should have a collection of them, 3 or 4, and you should wash it in the hot water cycle. I think that would probably be adequate.
Other questions or other things anybody else has?
Okay.
Yeah. Well, I would really want to thank you, Dr. Cheng, for taking the time to speak with us and to give us some really good information. I personally appreciate the information about the antibody testing, because I've had this cough and maybe I'm under the asymptomatic. I don't know, but that if I'm able to give my blood and to contribute to the research body, I mean that's fantastic. I would love to do that. But we really, I think those attending speak for all of you. I think I speak for all of us. We really appreciate sort of the way that you've been keeping up with this developing situation. Even sort of back in February, you had so much information, and you really, and it can be very stressful, I think, for anybody, whether in the health field or outside the health field, to immerse ourselves in something that we're all collectively experiencing. So we really appreciate your courage and your diligence in steeping yourself in the latest information and research and whatnot. So and delivering it to us in such a digestible and very just approachable manner. So thank you so much. I do want. Sorry, go ahead.
Go ahead. No, I'm just saying there's so much strength in being part of a community like this, and also, what I want to do is to make sure that everyone's got the right information, which, for the most part, as you can tell, is we don't know. But it's important to say that we don't know what we don't know, as you were alluding to, and not to pretend that we know something if it's not accurate. That's work.
Certainly. And as we wrap up, I do want to share one quick thing with those who are attending. This is from the Skywine College Health and Wellness website. Our wellness webinars are up here, very nicely listed. This is skywinecollege.edu/health and wellness, and the links actually go directly into Zoom, into where our webinars will be for the next ones. There's one tomorrow with SFSU students about maintaining your health, and we have our other ones coming up on Wednesdays. So you can just, if you're not sure, excuse me, there's that cough. If you're not sure how to access it, you can always go to our website and just click right through and join us for our future webinars. So thank you so much, everybody, for coming and joining, and we wish you wellness and be safe out there. And thank you, Dr. Cheng.
Thank you all. Take care.